World Breastfeeding Week. It is observed from the 1st to 7th of August 2024. The theme for the year 2024 is Closing the Gap. Breastfeeding Support for All. World Breastfeeding Week is held in the first week of August every year, supported by World Health Organization, UNICEF, and many ministries of health and civil society partners. The theme is Closing the Gap, Breastfeeding Support for All. The campaign will celebrate breastfeeding moms in all their diversity throughout their breastfeeding journeys, while showcasing the ways families, societies, communities, and health workers can have the back of every breastfeeding mom. Evolution of the campaign. World Breastfeeding Week is celebrated every 1st to 7th of August in commemoration of the 1990 Inner City Declaration. World Breastfeeding Week started in 1992 with annual themes including healthcare systems, women and work, the International Code of Marketing of Breast Milk Substitutes, community support, ecology, economy, science, education, and human rights. Since 2016, World Breastfeeding Week is aligned with the Sustainable Development Goals. In 2018, a resolution endorsed World Breastfeeding Week as an important breastfeeding promotion strategy. Objectives. First of all, it's to inform. Second, to anchor. Third, to engage. And fourth, to galvanize. So, inform. So, celebrations about the selected theme of the year. Then anchor the theme within the global breastfeeding agenda. Engage, that is with individuals and organizations for greater impact. Galvanize, action on the selected theme and related issues. The annual campaign. WABA coordinates the Global World Breastfeeding Week campaign that aims to inform, anchor, engage, and galvanize action on breastfeeding and related issues. Since 2016, it has aligned World Breastfeeding Week campaign to United Nations Sustainable Development Goals. This is known as WBW SDG campaign. World Breastfeeding Week. So, breast milk is the primary source for all the nutritional needs of infants in the first few months of an infant's life, as it comprises 87% water, 7% carbohydrates, 4% lipid, and 1% protein. Then vitamins and other minerals, calcium, phosphorus, magnesium, potassium, sodium, etc. Appropriate breastfeeding equipped with both maternal and child benefits that include prevention of child from getting severe diseases like short and long-term diseases such as respiratory diseases, sudden infant death syndrome, diarrhea, necrotizing enterocolitis, otitis media, obesity, type 1 diabetes. The importance of the World Breastfeeding Week. WHO and UNICEF recommends optimal breastfeeding, that is only breast milk without any additional food or water, exception to oral rehydration solutions, drops, and syrups in a child during the first 6 months of life, and then continuing to breastfeed until the age of 2 years with additional suitable and sufficient supplementary food. In developing nations, exclusive breastfeeding of infants younger than 2 years old has the highest potential impact among other preventive interventions on child survival, having the ability to save approximately 13% of all deaths in children under the age of 5 years. In addition, it is also critical to achieving many of the newly announced Sustainable Development Goals by 2013. As per WHO 2020 report, a newborn and young child feeding optimal breastfeeding, that is from 0 to 23 months, might save the lives of more than 8,20,000 children under 5 every year. The Indian statistics. As per 2015 global report, 59 lakh children or child deaths are reported, where India marks the highest share with 20% of it. The UNICEF, that is the United Nations International Children's Emergency Fund, India Statistics 2015 reports malnutrition is responsible for over half of the nation's under 5 mortality and infant mortality rates of 48 and 38 per thousand live births respectively. In addition, the report states that Indian women had subpar recommended breastfeeding practices, as only 65% of the infants were reported for exclusive breastfeeding at 6 months of age, and 45% of infants with early initiation of breastfeeding, that is cholesterol milk, within 1 hour. The challenges to optimal breastfeeding practice. Various determinants affect a successful optimal breastfeeding practice, including family and community health systems and services, and community health systems, socio-cultural factors, mother-infant interaction, workplace, employment, others. So multiple studies have demonstrated that breastfeeding rates can rapidly increase if the above mentioned determinants are addressed with the help of enabling measures. Among them, workplace and employment and returning to the workplace is one of the most common and important factors for an unsuccessful optimal breastfeeding practices, as many women worldwide spend a significant amount of time away from their children at work within the first year of giving birth. Therefore, World Breastfeeding Week strives to enlighten the stakeholders or policymakers in changing the workplace environment by adopting breastfeeding policy, thereby promoting optimal breastfeeding practice and its impact on development of infants. World Breastfeeding Week, the theme for the year 2024. This year's theme is Closing the Gap, Breastfeeding Support for All. The theme highlights breastfeeding women's diversity at every stage of their feeding journey, while demonstrating how family, societies, communities, and health workers can support all breastfeeding mothers. Many work-related variables such as full-time maternal employment, rigid work schedules, and lack of paid maternity leave and lactation rooms created significant barriers to working mothers' nursing practices. Globally, more than 50 crore working women are still not having access to vital maternity benefits, and many more are unsupported once they return to their workplace. As per World Health Organization, every woman, whenever during a job, ought to have the following, that is paid maternity leave for at least 126 days, that is 18 weeks, and ideally longer than 6 months. Then paid lactation time off to nurse their kids, and provision of flexible return to work options. The year-by-year themes for World Breastfeeding Week. In the year 2023, the theme was Let's Make Breastfeeding and Work Work. The 2022 theme was Step Up for Breastfeeding, Educating and Support. 2021, the theme was Protect Breastfeeding, a shared responsibility. The 2020, the theme was Support Breastfeeding for a Healthier Planet. In the year 2019, the theme was Empower Parents, Enable Breastfeeding. 2018, the theme was Foundation of Life. The Indian Maternity Benefit Act of 1961 for breastfeeding working women. Here it says that paid maternity leave for 26 weeks to women workers, and every establishment with 50 or more employees is required to have a creche facility or nursing facility, either separate or a nursery, either separate or along with common facilities, and women employees are permitted to 4 times each day until the child reaches the age of 15 months. A woman who has lawfully adopted a child under 3 months, or a mother is or a commissioning mother is entitled to maternity benefits for 12 weeks from the date the child is given over to the adopted mother or the commissioning mother, as the case may be. Now, coming to the history of World Breastfeeding Week. World Breastfeeding Week is celebrated every year from August 1st to August 7th in remembrance of the Inner City Declaration from 1990. Since 2016, Sustainable Development Goals has been in sync with the World Breastfeeding Week. The World Health Assembly Resolution 2018 endorsed World Breastfeeding Week as a vital strategy for promoting breastfeeding.